earwax. In this article, earwax causes, earwax symptoms, when to seek medical care for earwax, exams and tests, earwax treatment and self-care at home, medical treatment for earwax blockage, preventing earwax blockages. Outlook. Earwax is produced by glands in the ear canal. Although scientists are still not completely sure why we have earwax, it does trap dust and other small particles and prevent them from reaching, and potentially damaging or infecting the eardrum. Normally, the wax dries up and falls out of the ear, along with any trapped dust or debris. Everyone makes earwax, but the amount and type are genetically determined just like hair color or height. Smaller or oddly shaped ear canals may make it difficult for the naturally occurring wax to get out of the canal and lead to wax impactions. Earwax causes blockage, or impaction, also occurs when the wax gets pushed deep within the ear canal. Earwax blockage is one of the most common ear problems doctors see. The most common cause of impactions is the use of Q-tips, and other objects such as bobby pins and rolled napkin corners, which can remove superficial wax but also pushes the rest of the wax deeper into the ear canal. Hearing aid and earplug users are also more prone to earwax blockage. Earwax symptoms. Symptoms of an earwax impaction include decreased hearing, dizziness, ear pain, plugged or fullness sensation, ringing in the ear, itching or drainage from the ear canal. When to seek medical care for earwax. See your doctor if you think you may have any symptoms of an earwax impaction. Other conditions may cause these symptoms, and it is important to be sure earwax is the culprit before trying any home remedies. Go to the hospital if you have a severe spinning sensation, loss of balance, or inability to walk. You have persistent vomiting or high fever. You experience sudden loss of hearing. Exams and tests. A doctor can diagnose earwax blockage, or eardrum perforation, by listening to your symptoms and then looking into your ear with an otoscope, ear scope. Earwax treatment and self-care at home. Your doctor may recommend that you try an earwax removal method at home, unless you have a perforation, hole, or a tube in your eardrum. Over-the-counter wax softening drops such as Debrex or Murine may be put into the affected ear and then allowed to drain out after about 5 minutes while holding the head to the side, allowing the drops to settle. Sitting up again will let the drops drain out by themselves. A bulb-type syringe may be used to gently flush the ear with warm water. The water should be at body temperature to help prevent dizziness. Ear candling is not recommended. The procedure uses a hollow cone made of paraffin and beeswax with cloth on the tapered end. The tapered end is placed inside the ear, and an assistant lights the other end, while making sure your hair does not catch on fire. In theory, as the flame burns, a vacuum is created, which draws the wax out of the ear. Limited clinical trials, however, show that no vacuum was created, and no wax was removed. Furthermore, this practice may result in serious injury.
I advise against any use of hydrogen peroxide and against the use of any product for more than a few days, as both can lead to irritation. If you find that your ears are blocked with too much wax, place a cotton ball dipped in mineral oil into your ear canal for 10 to 12. Hello, welcome at us channel Dr. Pop. That's it. How to properly maintain your ears and earwax. We spend a good portion of the day using our hearing, but we know very little about how to maintain our ears properly. There's a lot of confusion out there about how to properly take care of our ears and maintain our earwax, so let's set the record straight. We sat down with Dr. Dan Biswasser, the primary care physician, and asked him how to properly maintain our earwax, also known as salutin. Here's what he told us. Stop using cotton swabs for starters. Earwax plays an important role in protecting the outer ears from infection and trauma. Having a certain amount in your ears is healthy. When you use a cotton swab, e.g., Q-tip, to clean your ears, you're actually pushing earwax further into your ear canal and up against the eardrum. At worst, It could damage your external ear canal or even rupture the fragile eardrum. There is no need for routine ear care for most people, said Weiswasser. In my experience, the more aggressively you remove wax, the more aggressively the body will produce it, and this can lead to a vicious cycle. It might feel funny to go without clearing your ears at first, but your body will adapt and gradually produce less earwax when you stop getting rid of it. Generally, the movement of your jaw will propel the earwax to empty itself out of the ear canal. The point of earwax is to trap dirt and contaminants before they reach your inner ear, so getting rid of it could actually harm you. The old adage, "Put nothing in your ear smaller than your elbow," rings true. Even if you have water stuck in your ear, don't use a cotton swab to dry it out. Instead, you can encourage it to evaporate by blowing on it with a hairdryer, set on cool, or by putting a couple of drops of rubbing alcohol in your ear. Usually, routine bathing should take care of any earwax outside of your ears. If you really want to maintain the exterior of your ear, stick with something with shorter reach, like a cotton ball or Kleenex, and don't stick them into your ear canal. The cotton swab may be too tempting. To avoid sprays, try mineral oil. If you haven't had trouble with your eardrums in the past, it's generally safe to use most kinds of room temperature mineral oil to ease out stubborn wax. Weiswasser explained. I generally advise the use of mineral oil. Baby oil is largely comprised of mineral oil but also often contains perfumes, which can be irritating and, thus, should be avoided. There are also over-the-counter earwax removal products, which, to my knowledge, have not been